Deb, I keep getting asked by a lot of veterinarians about the stance analyzer and how that could actually fit into their practice, and if they have to be kind of a high-end orthopedic sports medicine rehab specialty practice like ours, or if there's any use of this in general practice.
Yeah, and I think it's a perfect product for a general practice, for a practice that wants to extend their knowledge and their ability to diagnose lameness problems. And so I think it's, since that paper came out that we did here, comparing it,
paper.
Comparing it to the gait mat, where we can actually correlate it. So I think it's a great entry product for general practitioners, wanting to go and hone in their skills of being able to say, hey, this dog is off weighting on one side, and let's monitor that for a week or two. Hey, he's not getting better. Maybe we should refer him off.
Yeah, no, I was trying to think of our subset of cases with all the agility dogs and sporting dogs and working dogs we see. I was like, well, how would general vets use it? Well, think about just arthritis. You have a dog that comes in and it's a puppy, and it's a Bernese Mountain Dog, and on again, off again for a little minutes. But even if you can't tell which leg it is, sometimes you're like, is he off on the left? Is he off on the right? It can be challenging. They're on the stance analyzer. Yep. It helps to actually objectively, it's all about data, see which limb he's lame on. And so that helps you to clue in that, yep, it is the forelimb, we're not losing our mind, and it gives us a baseline. Right. So if we do some sort of treatment, you do medical management, you do rehab, laser therapy, you scope it, whatever you're doing, injections, you can see if they're getting better, because there's such a huge anecdotal kind of placebo effect, everything people do. This way, every time they come back in, they can go back on the stance analyzer. And I was thinking about, how do they generate income? Well, it's a diagnostic tool, just like a radiograph or an ultrasound or a scope or an MRI. And this is another tool.
It's objective, and it's something that can be given to the owner. The owner can see it black and white, like, okay, he was 20% here, and now he's 25%, and so they can actually see that. And I think that's what owners like. They don't want you to go back to a microscope and then be like, oh, he has this. They get that piece of paper to go home. So I feel like that's a valuable piece of data, both for the general practitioner and the client.
And that's been the situation I've had as well, where a dog has come in with, say, elbow arthritis. We've done a treatment, and the owner's come back saying, listen, I'm coming in for all this rehab, we're doing photobiomodulation, I don't think we're getting anywhere. And you're like, well, here was your initial data on the stance analyzer. I know we're a month and a half in, but look at the data, look at the difference. And all of a sudden they're like, oh, wow, yeah, we should continue doing this. And it really kind of allows us to see we're doing the right thing, because not every dog responds to every treatment, and you need to make sure, if you don't, change plans. But it helps that owner see that they're, all the work they're doing at home with home exercises and coming in for the treatments, it's actually paying off.
Yeah, and I mean, in my opinion, it's a great entry-level tool for the general practitioner, because everybody, when I came out of vet school, I put an x-ray up, I'm like, it's not broken, I have no idea what else is wrong with your dog.
Soft tissue.
Yeah, it's soft tissue, please go away, don't come back. And so this is a great way for a general practitioner to, again, get just a little bit more honing on the skills, and then when they see that this is not changing and there's still that persistent off-weighting, then they know that it's time to refer. So I think it just empowers them to have a bit more into the orthopedic field that sometimes as veterinarians, as general practitioners, we're a little scared of.
I like the fact it's user friendly. Yeah. I mean, when I was thinking back to some of the gait analysis studies we would do back at the university when we used force plate, you pretty much needed a biomedical engineer degree or a PhD to actually understand the data with force plate. This is something that your veterinary nurse or your technician can go, actually place the dog on there, get the data readily, give it to you, send it to the referring veterinarian, send it to the rehab therapist, keep it in your file so you have something to follow pre and post. Fairly easy, as far as that's concerned. And also cost-wise, way less expensive than some of the other technologies that are out there.
And again, I think the community as a whole is looking at objective data. I think people are being more and more educated that, it just shouldn't be like, yeah, he seems to look better. I think they really appreciate that and see that as something significant.
So you'd recommend stance analyzer for general practice?
Yes, absolutely.
Okay.